Hello, I'm Dr. Curtis Horstman, and I'm the Medical Director at Ozarks Medical Center's Emergency Department. The safety and security of our patients, residents, visitors, and coworkers are at all times our highest priority. We are working closely with our vendors and suppliers to ensure appropriate inventory levels of all clinical supplies are maintained and emergency supplies are available. Our coworkers are highly trained and experienced in emergent situations. There's a lot of discussion about personal protective equipment known as PPE. I want to take a moment to clarify some of the questions surrounding the use of masks, one type of PPE. Currently, OMC is building an adequate supply of masks and other PPE and continues to receive more every day through our approved suppliers, generous donations from individuals and organizations, and most recently our state government announced more supplies are on the way. Our goal is to have a PPE supply sufficient to care for 75 patients for 30 days. No doubt you've seen several types of masks, typically falling into two categories: surgical and what are called N95 or respirator masks. You will see different healthcare personnel wearing both types of masks. Typically, surgical masks, like this one, are worn to guard against direct contact with something that may prove to be infectious, such as droplets transmitted through a sneeze or a cough. The CDC is recommending the use of surgical masks when caring for COVID-19 patients for protection from infectious droplets. N95 masks offer advanced protection from infectious particles that are aerosolized and can be transmitted past the 6-foot space that droplets tend not to travel. Healthcare workers who typically wear the N95s are those performing aerosolizing procedures. CDC is recommending the use of N95 masks when caring for COVID-19 patients if you are performing aerosolizing procedures, such as breathing treatments, intubation, or managing the circuitry of a ventilator. Lastly, you may see people in public walking around with masks. We recommend that people wear masks when they are clinically suspected of having COVID-19 to protect others from their infected droplets. We do not recommend that people who are not sick wear a mask. As a reminder, homemade fabric masks are still not approved as healthcare PPE at this time. Healthcare facilities will use these as a last resort when all approved PPE supplies are gone. There is some evidence that these homemade masks may actually increase rates of infection. Although you may not see us wearing them, we're happy to have them as backup. We greatly appreciate the outpouring of support in regards to members of the community sewing masks for us at OMC. OMC continues to operate to meet the needs of the communities we have the honor of serving. Proactive steps we put into place are to limit the possible transmission of COVID-19. We'll continue to review and update policies and procedures as needed and at the direction of state and federal authorities. Please be assured, despite visitor restrictions, OMC will continue to provide care to all those who seek treatment at our facilities. If you have any questions about exposure or symptoms, please call our hotline at 417-505-7120.